unresolved issues that had not been addressed with the Star Kids rollout less than a month and a half away. Yet, during that time period, we were repeatedly assured by HHSC leadership that not only was the Star Kids program fully ready to go live, but this product is different and has been customized for the needs of medically fragile children, and we were told repeatedly that it would not be the same as other managed care products. Time and again, we were told that parents' concerns around increased barriers to care, increased denials, reductions in nursing and therapy services, conflicts between primary commercial plans and MCO plans, and other difficulties historically experienced in other managed care programs were simply parents fear-mongering and ignorant parents who really didn't understand the program or what was trying to be done here. Yet here we sit 1 year later. Red tape, bureaucracy, barriers to accessing care have exponentially increased since November 1st, 2016. Broken families who are already overwhelmed and maxed out are stressed beyond belief attempting to meet basic daily needs for their fragile children that previously had not been a problem to access under traditional fee-for-service. Denials abound. One physician in Dallas who specializes in dealing with children discharged from the NICU recently told a family that they were unable to respond to a denial and provide them with a letter of medical necessity in a timely fashion because they have been completely overwhelmed with MCO denials and are swimming in them at a level that they have never seen before, to the point that they were going to have to hire a full-time nurse solely to deal with denials. On a daily basis, families of medically fragile children are experiencing PDN nursing hours being dramatically cut from as much as 78 hours a week to 18 hours a week, or from 80 hours a week to nothing. Not just by 1 or 2 MCOs, but multiple MCOs across the board. Therapy denials are rampant across all MCOs, and families are essentially being intimidated in many so-called fair hearings, with as many as 10 or more representatives of the MCO defending a denial versus a parent and a therapist. One family was recently told in so many words by a medical director representing an MCO that their medically fragile child basically isn't worth the cost of therapy because of her diagnosis and associated long-term prognosis. The therapy rate cuts are being used as an excuse to increase denials and further cut services. Problems accessing prescription medications abound, and as recently as this month, it took one family nearly 3 weeks to obtain an urgent and critical medication for their medically fragile child in crisis due to barriers set up by the MCO, to the point where the child's condition has now deteriorated and his physicians are talking about full TP and IV nutrition being the only viable option. Indeterminable conflicts between private commercial insurance plans and secondary Texas Medicaid managed care plans abound, to the point that we have actually seen some families drop their primary commercial insurance and others are seriously considering doing so. Medical necessity denials for MDCP have massively increased, far beyond historical denials, and it is clear from the data that there is a breakdown or problem with the new process and or the new tool, or all of the above. And yet, requests to address this issue in a way that holds families harmless has seemed to have fallen on deaf ears. While we very much appreciate the efforts of HHSC to perform internal desk reviews and other items, it still does not address the greater underlying problem. Hiring A&M to hold feedback sessions with families, providers, and MCOs to review the SKSAI and propose long-term changes more than a year or so down the road is great, but it is not an adequate or appropriate solution to the current urgent problem and underlying broader issue of a breakdown or multiple breakdowns in the assessment and approval process. Furthermore, it is an enormous conflict of interest. A&M were the ones who developed the current tool. Why are we hiring them to assess their own work and to review their own work? As I sat here listening to the discussion about the massive increase in denials, I also heard families blamed for this problem. Families are not reading their email or their mail, therefore they're not understanding what the process is. They're not understanding the letters. And I just have to take a minute and stop and think about that. Why aren't families being held harmless in this process? HHSC has changed this process, and the responsibility lies with HHSC to identify the breakdown in the process and correct the problem. Families should not be suffering the impact of HHSC's inability to admit and address mistakes and rectify the issue. What I also here was the June and July denial data that has been requested repeatedly for months on end, or the fair hearing data that has also been requested repeatedly for months on end. I didn't hear anyone talking about how we can drill down into the broader process and use that data to address and rectify the underlying problem and put a halt to the denials until we can identify and correct where those breakdowns are happening in this brand new system with multiple possible points of failure. That, to me, as both a parent and a representative of many families across the state and a business person, is unacceptable. Above and beyond that, formal complaints from families and requests for assistance with resolution to the Health Plan Management Unit, the Ombudsman's Office, and many others within HHSC who have been referenced as resources have not only produced very little in the way of results, but usually are not even properly documented. If we don't have good data, how can we make good decisions? So 1 year later, as we sit and look back on all the promises that were made when we all sat in this room last September and before that, are we really where we want to be? Has this program improved families' lives and their ability to care for their medically fragile children? As a representative of families and as a family member myself, I would have to say my answer is no. And that is not acceptable. Thank you for your time.
Hannah, if you have your remarks written down, would you provide us with a copy, please?
I don't have a hard copy with me.